If there were an internet-wide vote for the most viral photo in 2024, the only contender that could possibly outshine the image of Trump, fist raised and yelling "fight off the taking a bullet," would be the iconic shot of modern-day Robin Hood, Luigi Mangione, rocking his sultry yet unmistakably inmate chic prison look. On December 4th, the news broke that the CEO of United Health Group, the largest health insurance company in the world, was shot dead on the street. But instead of the crime itself becoming the main talking point, the real headline stealer was the gunman, Luigi Mangione. After being arrested, Luigi's background, rich family, Ivy League graduate, good looks, and impressive physique overshadowed the actual shooting. What really captivated the internet, though, were the 3 bullets he fired, each inscribed with the words "delay, deny, and defense," a clear jab at how U.S. insurance companies delay and deny claims to avoid paying out. No one seems to mourn the crime. In fact, Luigi gained a massive following, with many netizens calling for his acquittal.
Your Honor, he's not a symbol. He's somebody who is afforded the right to a fair trial. He's innocent until proven guilty.
His actions sparked outrage, and people began voicing their disdain for the greedy U.S. insurance industry, especially companies like UHC. So what exactly made UHC and other insurance companies the villain in this drama? Here's the scoop. The US is known for its cutting-edge medical innovations, from pioneering new drugs to the FDA's strong backing of breakthroughs. America leads the world in healthcare innovation, and let's not forget the US also leads the world in healthcare spending. $14,000 US per person in 2023, nearly 3 times higher than Germany's $5,300. But here's the kicker. Despite the high-level healthcare, the US has the lowest life expectancy and the highest infant mortality rate among developed nations. So, with all that spending, why are the results so underwhelming? At the core of this mess lies the healthcare system's triangle: patients, insurance companies, and healthcare providers. Patients pay insurance premiums, insurance companies pay healthcare providers, and healthcare providers heal patients. In theory, this system is supposed to keep things in balance. Insurers curb overtreatment by raising premiums, while providers lower prices through price agreements. And patients can vote with their feet by choosing their insurers and healthcare providers. But here's where it gets tricky. The insurance companies are the central hub of this entire system. They control the flow of money. And in the case of UHC, they found a way to monopolize the whole damn chain. By 2024, UHC insured 49 million Americans, about 15% of the population, through commercial insurance, Medicare, and medical aids. With that many customers, UHC began creating its own network of healthcare clinics. The idea was simple. UHC struck deals with hospitals and clinics for discounts. In return, they would funnel patients to those facilities. Sounds good, right? Bulk buying means lower costs for everyone. Logically speaking, this bulk for discount approach should help drive down overall healthcare costs. By doing so, insurance companies could pass on these savings to customers. This would not only reduce premiums, but also make their insurance products more competitive in the markets. Except that that's not how it worked out. From 2000 to 2024, the average American family's insurance premiums skyrocketed from $5,791 to $22,572, a 4-fold increase. Meanwhile, inflation only rose by about 200%. So where did all the extra cash go? Well, it went straight into UHC's pockets. They raised premiums while cutting payouts, creating a sweet little profit margin at the expense of customers. And it doesn't stop there. UHC's next move was to drain hospital and doctors dry. With their network, they control the flow of patients, making it hard for hospitals outside the network to survive. Then came Optum, a subsidiary of UHC's that started out by managing patients' data. But once it had enough data, it pivoted to something much more sinister, bankrupting hospitals and then buying them out. Optum started giving loans to hospitals to cover the gap between treating patients and waiting for insurance payouts. UHC's plays both sides, paying for care and acting as a lender to the clinics. It's almost too easy to pull strings. The catch? Denied claims. Patients get treated, hospital foot the bill, and then the UHC just refuses to pay. UHC's denial rate was over 30% in some states, in some cases, in nearly 50%. This doesn't just bankrupt patients, clinics are folding too. In 2023, 79 healthcare facilities filed for bankruptcy, the highest in 5 years, more than triple the number from 2021. And guess who swoops in right after the clinics go under? Optum, UHC's partner in crime. They step in to buy them up. UHC likes to call this vertical integration, but let's be real, it's more like cornering the entire healthcare market, one foreclosure at a time. After this, UHC and Optum's parent company, United Health Group, grew into the biggest healthcare empire in US. They now have over 70,000 doctors on payroll and indirectly control around 100,000 more, roughly 10% of all doctors in the country. The once balanced triangle of insurers, hospitals, and patients, completely shattered by corporate greed. But it didn't stop there. After draining the entire healthcare industry dry, UNH set its sights on the next jackpot: government money. In July 2024, the Wall Street Journal reported that UHC had been using false diagnoses to claim millions from the government's Medicare Advantage program. In 2021, UHC raked in $8.7 billion in their fraudulent claims, over half their net income for the year. So what do we have here? A healthcare system that turned into a cash cow for greedy insurance companies like UHC, who proudly boast about being the biggest and most profitable health insurance company in the game. And the worst part? Whether you're using their insurance or not, you're still likely to end up seeing one of their doctors and contributing to their profits. It's a monopoly disguised as a healthcare system, and the American public is left with no way to fight back. And welcome to medical dictatorship, folks. Luigi's 3 bullets hit like the shot heard around the world. Except this time, the dragon was a greedy health insurance giant, and the slayer, a 26-year-old with nothing to lose. But this is just the opening act. With social media ablaze, the reckoning for America's healthcare vampires is only getting started.